Hello, everyone, and welcome to Preemie Chats, a place for parents and healthcare professionals to gather, share stories, and learn from each other. My name is Jenna Morton. I'm one of several co-hosts who present this weekly series on behalf of the Canadian Premature Babies Foundation. I'm a career broadcast journalist and mom to 3 NICU grads, including preemie twins who were born at 32 weeks and are now 13 years old. I live and work in Mi'kma'ki, outside of Moncton, New Brunswick. Well, Preemie Chat is the creation of the Canadian Premature Babies Foundation. The foundation is a parent-led charity that helps families during and after their NICU time through education, support, and advocacy. I hope that you will take some time to visit our website. You can see it there on your screen, canadianpreemies.org. On the website, you will find all kinds of resources. There are links to our previous Preemie Chats, our podcast episodes, parent handbooks, all kinds of information. Most importantly, though, what you're going to find at canadianpreemies.org is a community of parents and professionals who are working together to help our children thrive. Well, I would love to know today where you are joining us from, what brings you to us, whether you are a preemie parent, a grown preemie, if you work in the healthcare industry. We would love to know what brings you to Preemie Chats and where you are joining us from. We have people that watch and tune in from around the world. We would love to know where you're coming from, what brings you here. And as we go through today's presentation, please, if you have questions for our guest, if you have experiences to share, please feel free to share those in the comments as we go through today. Well, as we know, there are a lot of anxieties and worries around making the best choices for our children, particularly with infants when it comes to safe sleeping. And today's presentation is meant to help you calm your concerns and to empower you. We're going to get an overview of Health Canada's Consumer Product Safety Program. Those are the rules and regulations that our government has in place to ensure that products such as cribs and bassinets are safe for you to use. Our guest is also going to share some tips on how you can make safe choices around sleep and the sleep products that you have for your child. Elise Carrier has more than a decade of experience in the regulatory compliance field. She spent the last several years as a regional regulatory compliance and enforcement officer with Health Canada's Consumer Product Safety Program, and I am thrilled to welcome her to Preemie Chats. Hello.
Hi, Jenna. Thank you so much for this opportunity to present today. And good afternoon, everyone that's watching. As Jenna mentioned, my name is Elise Carreri, and I'm a product safety officer with Health Canada's Consumer Program, Consumer Product Safety Program, that is, sorry. So today I will be presenting on safe sleep information for infants through the consumer product safety lens. And while this information isn't specific to premature infants, it is, of course, very applicable and even more pertinent for this vulnerable population. So this presentation is very timely as we are on the heels of Safe Sleep Week, the annual mid-March awareness campaign that promotes infant safe sleep practices. So during Safe Sleep Week, Health Canada and partner organizations work together to educate caregivers on the risks of unsafe sleep environments. The theme for this year's Safe Sleep Week is Safe Sleep Everywhere the Baby Sleeps. And I encourage you to look up this year's campaign online if you haven't had the chance to do so. So before we begin, I would like to acknowledge that as I present to you from Toronto, I am on the traditional territory of many nations. Nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. And this is now home to many diverse First Nations, Inuit, and Métis peoples. I recognize that others may be joining from different places and may be located on different Indigenous traditional territory. I encourage you to take a moment to think about this. Okay, so the intent for this presentation, as Jenna mentioned, is to provide information on hazards associated with some sleep-related consumer products and how those hazards are mitigated by regulation. I also want to share some tips on using products safely. Okay, so the Consumer Product Safety Program is a federal department of the Government of Canada, and it's a unique program that operates under a post-market system. So this means that there is no pre-market review, approval, or licensing of consumer products, as there are for some other product categories, such as drugs or natural health products. So given the sheer number of and variety of consumer products on the market, it's simply not possible for our program to review and approve all products prior to sale. It is industry's responsibility to ensure that the consumer products that they sell are safe and that they meet the applicable regulatory requirements. Health Canada's Consumer Product Safety Program is responsible for administering and enforcing product safety legislation, and our mandate is to protect Canadians from unreasonable risks associated with the use of consumer products. And we do this by promoting, monitoring, verifying, and enforcing compliance to consumer product safety legislation. We also provide education to help consumers choose products safely, or to choose safe products, and to also inform them on how to use products safely. Exactly what we're trying to do today here with this opportunity. Okay, so consumer product is a broad term. So what exactly does that mean? Well, here on this slide, we have a technical definition from legislation, but in simpler terms, if you were to walk into a big box store and you take away food, drugs, medical devices, pest control products, our program pretty much covers everything else in that store. And in addition to consumer products, we also oversee cosmetics. So we do look at a wide variety of products. So in making product safety legislation and evaluating the safety of products, we consider the hazards that products pose. And there are primarily 5 hazard categories. One being mechanical. These are physical hazards which may cause injuries, such as choking on a small part that may be released from a product. There are chemical hazards, for example, poisoning due to the presence of a toxic chemical in a product. There are flammability hazards that arise from a product's potential to catch fire and burn. There are biological hazards, such as bacterial contamination in a product that could cause infection if an individual were to be exposed to it. And also electrical hazards, such as injury or property damage resulting from fires, burns, and shocks. And so consumer products are regulated to help minimize the hazards associated with them. Okay, so the Consumer Product Safety Program enforces and administers the Canada Consumer Product Safety Act. This act is a policy which states that consumer products must not pose a danger to human health and safety. In addition to this general safety requirement, the act includes a list of products that are prohibited in Canada. The act also lists powers that product safety officers like myself have that allow us to monitor, verify, and enforce compliance to the legislated safety requirements. Under the Canada Consumer Product Safety Act, there are over 30 regulations for certain product categories, for example, cribs, cradles, and bassinets, and they outline safety-related design and criteria for performance and labeling of products. Regulations are established, again, to minimize the potential hazards associated with consumer products, and they're often established in response to reports of incidents related to the use of consumer products. Okay, so now that you know a bit about our program and what we do, let's get into the main messaging of this presentation, which is safe sleep information. And we'll start with some going over safe sleep surfaces and some sleep-related products. Okay, so there is a regulation for cribs, cradles, and bassinets. And under this regulation, there are a number of requirements that minimize the potential hazards associated with these products. Prior to current regulation, cribs posed a number of design-related hazards, which are exemplified on this slide here. So tall corner posts on cribs posed a strangulation hazard if clothing were to get caught on them. So under current regulation, corner posts must not be more than 1.5 millimeters in height. Wide slat spacing on cribs was also hazardous, as a baby could get their head trapped between the slats that are spaced too far apart. So under current regulation, spacing between crib bars cannot exceed cannot be more than 6 centimeters, and this is to prevent that hazard from occurring. A large gap between the mattress and the crib side also poses an entrapment and suffocation hazard. So under current regulation, the gap between the crib side and the mattress cannot exceed 3 centimeters. Drop side cribs also pose a fall and entrapment hazard due to faulty or broken hardware that causes the drop side to either detach or misalign. And since 2016, it is illegal to sell drop side cribs in Canada. Previously, mattress supports of cribs were often secured with an S-hook type of attachment that would allow for easy height adjustment of the mattress. However, S-hooks could easily be dislodged, creating an entrapment or a fall hazard if a baby were to be present in the crib. So under current regulation, the mattress support must now be bolted to the corner post to ensure that it's securely attached. So I want to go over some safety tips for cribs, cradles, and bassinets. First, we want to ensure that we're following instructions for proper assembly. Not assembling the product properly can create hazards and cause premature hardware malfunction. We also want to follow warnings and labels as they instruct on the safe use of the product. We also want to follow the manufacturer's guidance on the baby's age, weight limit, and developmental milestones to inform the safe use on the product. We want to examine the crib for loose or broken parts, such as nuts and bolts that could present choking hazards, or cracks and bends that could compromise the stability of the product or present other hazards. We want to ensure that the mattress is firm and flat. We know that babies can roll over onto soft surfaces and suffocate. So we want to ensure that we are using a firm and flat surface for sleep time. Again, as of 2016, drop side cribs cannot be sold in Canada due to the hazards that they present. And also, I want to note that we want to avoid homemade fixes. We want to be using manufacturer-provided parts for repairs. Homemade fixes can present unknown hazards, so we want to avoid this type of activity. Okay, so Statistics Canada released a report in 2021 on circumstances surrounding sudden and unexpected sleep-related infant deaths. And this graph on the slide is from the report. The main findings were that 70% of sudden and unexpected sleep-related infant deaths were for infants under 4 months old. So that's a particularly vulnerable time period in an infant's life. And also the report showed that stated that 9 in 10 infants who died suddenly in their sleep were in an unsafe sleep environment. 7 in 10 sudden and unexpected sleep-related deaths occurred on a surface that were not intended for infant sleep. And of this, 52% were on an adult bed or mattress, 9% were on a couch, sofa, or an armchair, and 6% were on an infant product that was not intended for sleep. So in 2021, a joint statement on safe sleep was developed in partnership between the Public Health Agency of Canada, Health Canada, the the Canadian Pediatric Society, and Baby's Breath Canada, with the goal of reducing sudden infant deaths in Canada. It provides healthcare practitioners with current evidence-based information so that they can offer guidance to parents and caregivers to reduce the risk of sudden infant deaths during sleep. It summarizes key principles of safe sleep based on modifiable factors in the sleep environment to reduce the risk of sudden and unexpected infant deaths. There is also a safe sleep booklet available online for parents and caregivers. Similarly, it's a practical guide on the modifiable factors to ensure a safe sleep for your infant. And because it is so important to ensure a safe sleep environment for an infant, there is a mnemonic to help parents and caregivers remember pertinent information, and that's the ABCs of sleep. A is for alone. Babies should be sleeping alone in a crib, cradle, or bassinet. Think of room sharing instead of bed sharing. The crib, cradle, or bassinet should also be free of loose, soft items like blankets, quilts, pillows, mattress toppers, toys, and bumper pads, as these can, the babies can suffocate against these. And so essentially an empty space is best. B is for back. We want to place the baby on the back to sleep every time, including naps. When a baby can roll over on their own, repositioning them onto their back is not necessary, but it is still safest to put them on their back to sleep. And we don't want to use sleep positioners or wedges to keep the baby on their back because these also present suffocation hazard. C is for crib, cradle, and bassinet. Again, we want to ensure that a baby is sleeping in a crib, cradle, or bassinet that meets current Canadian safety regulations. And this would be a crib that has a firm, flat surface, and we also want to use a tightly fitted sheet. Cribs should also be placed away from electrical cords and blind or curtain cords, which babies can strangle on. Okay, when we're dressing baby for sleep, we want to look for sleepwear that is simple and well-fitted. Sleepwear that's too big can ride up and cover the baby's nose and mouth, posing a suffocation hazard. Daywear is not designed with sleep safety in mind. So for sleep, we want to choose clothing like a sleeper that is intended for sleep time. We also want to check sleepwear regularly for loose buttons, zippers, snaps, or other small parts which could become a choking hazard. We also want to look for loose threads which could wrap around baby's arms, legs, fingers, toes, and neck and cause injury. Sleep sacks are often used as an alternative to a blanket. For these products, we want to make sure that they fit right. If it's too big, a baby could slip down inside the sack, which could make the baby overheat or suffocate. If it's too small, the baby might not be able to move their hips and legs freely, which can also be dangerous, especially if they roll onto their tummies and are unable to move around. We also want to make sure that the sleep sack is appropriate for the temperature of the room. So think of a lighter weight sleep sack for a warmer room. And there may come a time when a family may be traveling or visiting family or friends. And in this case, it is important to plan ahead to make sure that the baby has a safe place to sleep. As previously mentioned, you'll notice I mentioned this several times. The safest place for a baby to sleep is in a crib, cradle, or bassinet that meets the current Canadian safety requirements. Note that some playpens, they do have a bassinet attachment that may be an option for sleep while traveling until the baby can roll over or they reach the manufacturer's weight limit or certain developmental milestones. And you should refer to the manufacturer's instructions for that. Bed sharing is not recommended as it increases the risk of sudden infant deaths, especially during the first 4 months of life. Playpens are not recommended for unsupervised sleep as they are not made as durable or have the same safety requirements as cribs. However, a few slides from now, I will provide some tips to follow if a playpen is used for a temporary sleep arrangement while traveling. But first, I want to provide some information on the potential hazards that these products can pose and some general safety tips for use. Okay, so I apologize for the smaller image on this slide. I will provide some description on that. So playpens, they do pose several hazards, like those presented here on this slide. For example, strangulation and entrapment hazards if the slide is not raised, or if the sides are not raised to their full height, or if their locking mechanisms are not properly engaged. So we do, on setup, we want to ensure that the sides of the playpen are at their full height and the locking mechanisms are secure and fully engaged. The third image also shows potential strangulation hazards that may be present if accessories or toys are placed across the playpen. So we want to avoid doing this. Okay, so here are some safety tips to keep in mind for playpens. We want to follow the manufacturer's instructions regarding assembly and use. We want to remove attachments when the playpen is being used to avoid a risk of entrapment. For example, a baby's head could become trapped between the gap of the change table or bassinet and the playpen walls. We also want to ensure that the mattress pad in the playpen is the one that's applied by the manufacturer and that it's firm and flat. So as previously mentioned, playpens should not be used as the primary sleep environment. They're not intended for unsupervised sleep, but in some cases, parents and caregivers may choose to use playpens as a temporary sleep arrangement while traveling. And if this is the case, they should ensure that the playpen is placed on the floor in the same room as the parent or caregiver. We do not want to place the playpen too close to a bed to prevent blankets or other soft items from falling in, as these could pose a suffocation risk. And we do not want to add an extra mattress or padding for the same reason. This could pose a suffocation risk for the baby. So babies often fall asleep in baby-wearing products like slings, wraps, or carriers. Premature babies and babies under 4 months old in particular have poor neck control. And so we want to ensure babies are safe while in these baby carrying products. To do this, you can follow the visible and kissable approach. And this means that the baby's face should be in view at all times so their breathing can be monitored. They should also be positioned high and upright with their chin up and away from the caregiver's body. They should be positioned with their chest and tummy against the caregiver, and the carrier or sling should be snug enough to support the baby's back in a natural position. When baby wearing, it is important to check the baby often, monitor their breathing, and check for overheating. Okay, so I want to address some other infant products here. In the 2021 Statistics Canada report on sleep-related infant deaths that I referred to previously, it found that almost 70% of sudden and unexpected infant sleep-related deaths occurred on a surface not intended for infant sleep. And of those, 6% of these cases were on an infant product that was not intended for sleep. For example, incline products like swings, bouncers, high chairs, strollers, car seats, they're intended for babies, however, not for sleep. These products can increase the risk of positional asphyxia, meaning that the position that they create for the baby can make the baby tilt their head forward, which can compress the airway, making it difficult for the baby to breathe. Baby nests or pods are small portable lounging pads for infants, and they typically have a quilted, cushioned, or a fabric bottom with soft padded sides. A baby can suffocate against the soft padded sides, so it's important to know that these products are not safe for sleep. Also, Health Canada recommends against using bedside sleepers that attach to an adult bed. babies can get trapped in the space between the bed and the bedside sleeper, and this can pose hazards for entrapment, so the baby getting trapped between that space, and also suffocation. Okay, so while mentioned on the previous slide, I did want to share a standalone message for car seats. Babies often fall asleep in car seats, but we should remember that car seats are designed for safe travel and not for sleep. It is recommended to move a baby to a safe space, even if your baby is sleeping soundly, when you arrive at your destination. Premature babies or those born with certain medical conditions may have poor neck control, and they are at higher risk of suffocation in a car seat. When your baby's head falls forward, it limits the amount of air that they can take in, restricting their breathing. So before taking your baby on a long car ride, you might want to talk with your doctor to ensure that your baby is big enough and strong enough to ride safely in the car seat. You can take some steps to ensure that your premature baby is safer in their car seat. First, you want to ensure that you keep a close eye on your baby, if possible, and have an adult sit in the back seat to be able to monitor the baby often. You can limit the time that your baby spends in the car seat. Try to avoid longer car rides, and make sure that your car seat fits your baby. You want to check the manufacturer's guidelines and make sure that the harness straps are snug. We do not want to add extra padding or head supports that do not come with the car seat, as these can pose suffocation hazard. Okay, I also want to share some additional information primarily regarding secondhand products. As secondhand and thrift shopping is very common, a consumer product, whether it's sold as new or used, must meet safety requirements of Canadian regulations. So here are some quick tips for secondhand shopping. We want to ensure that all parts and components are present and functioning. Damaged products should not be sold. They should be discarded. Certain products like cribs, cradles, bassinets, or strollers must not be sold without instructions or the instructions for assembly. So we want to ensure that those are present at the point of sale. For these types of products, you also want to look for model numbers, date of manufacture, and warning labels. Model numbers are particularly important because this is what consumers can use to identify a product that's been recalled for a safety-related issue. You can check online on Health Canada's website for product recalls, and I'll show you on the next slide here. We do have a website that lists all consumer product recalls, and if you're ever curious as to whether a product has been recalled for a safety-related issue, you can easily search for previous recalls using the search bar and just enter the appropriate keywords. Recalls are often also listed on product manufacturers' websites, so that's another option for you to review. Something else I wanted to inform you on is that if you have a safety concern related to a consumer product, or you experience an injury related to the use of a consumer product, you can report it to us. And we do encourage you to do so using our online reporting form, by calling our toll-free number, or by emailing us. And to close, again, I want to thank you for this opportunity to present this important safety information with all of you. And again, if you have any consumer product safety questions, you can contact our program. The email presented on this slide is the way to do that, or you can call our toll-free number presented as well.
Thank you. There's so much great information in that presentation. It's fantastic. I think that there are probably a lot of families out there that are going to take a lot away from that, not just for themselves, but to share with the other people in their lives. Yes. I know that was a big piece for us when our kids were little. You know, if you're lucky enough to have that village or that family, they want to help, they want to give you things that they may have held on to for 15, 20 years. And you want to find a kind way to say thank you for the thought, but perhaps this isn't what my baby needs right now. And so knowing where to go to have that information to say, here are the guidelines, I think is a very empowering thing for families.
Yes, and that the Safe Sleep for Babies that's intended for parents and caregivers is a great resource to share with anyone that will be helping out with taking care of your infant.
Yeah, it's surprising sometimes, I think, to realize how quickly our guidelines and our rules and our regulations change as we realize what works best and what doesn't. And you were talking about how, cribs and bassinets, up until 2016 had drop size. I'm like, 2016 doesn't really feel all that long ago. That's only 10 years. Lots of people, especially if you have multiple kids, you could have a crib in your house for that long and not think of it as old yet.
Yes, yes. Baby products can be expensive, and so secondhand shopping, hand-me-downs are very common. So it's really important to be informed on what types of hazards these products can present. And so reviewing safety information on canada.ca, specifically Safe Sleep, is a great way to inform yourself on potential hazards and also just safe practices.
Well, and great to have that. It's very visual. It's very easy to follow and remind yourself of what some of the things are. And I know in terms of, purchasing things secondhand or having them passed down to you, one of the good things about technology is it's become that much easier to go online and find manufacturer instructions. So, if you have something that is very new that you're looking to pass on to someone, I'm sure, some people are the type who keep all the documents and all the manuals right with it. Some of us throw all that stuff away pretty quick. But I know I've made it a practice, if I'm going to pass on something like that, to go and do the due diligence myself before I offer it to someone, to look and see if it's been recalled, to print off a manual if I don't have it. So that's my little tip out there to the, the parents, grandparents, the people around someone. Take the time to do that yourself. Don't put it on the parent to have to do that work.
Yes, it's amazing what you can find online. Most current products have manuals available online. And just to keep in mind, if you are secondhand shopping, ask the retailer for the manual and the use instructions. If you don't see it there on the retail floor, they could and should have that available. So if you don't see that and they can't provide that, we recommend against purchasing that product. And you can also notify us about that through our online reporting system that I previously mentioned.
I had a question about that too, in terms of the reporting. What if someone, purchases a product, because you talked at the beginning, there isn't necessarily a process that products have to go through in the same way to end up on a shelf. But if someone were to see something and think, oh, that looks like a hazard, even if an incident hasn't happened, is that still something that they report through that same?
Absolutely. Yeah, an incident, an injury doesn't have to occur in order for you to report product safety concern to us. We do have a review system that we will follow and follow up on the concern appropriately. But we do review all of those incidents that come in, all of the reports of near misses, safety concerns. So that is a good way to notify us if you do have any concerns.
Yeah, I think it's so interesting to just kind of think about how those rules kind of influence design as well. I'm thinking about, the Sears catalog of my youth that had, these nursery sets with the bumper pads because you had wide slats, and, the big ruffle skirts that people would buy to put on cribs, and now it's so much more minimal, even in what is put out there in the design and what's available to purchase. And it's not just an aesthetic. There's safety reasons behind how these things have shifted, and it's really wonderful to see those changes happening.
Yes, and education, it informs not only regulation, it informs industry. Industry adapts to issues that they become aware of on their own as well, not just because they have to for regulatory requirements.
Yeah. Well, I don't see any questions from our viewers today, so I'm sure if they have some, you've given the information to reach out, and it's there on the screen as well. They can go to canada.ca/safe sleep and be able to find all kinds of fantastic resources that you shared with us. Thank you so much for taking the time with us today.
I really appreciate the opportunity. And again, you can look up all kinds of safe sleep information on canada.ca, as well as a broad spectrum of their consumer product safety information. So I encourage everyone to take that opportunity and review some really important safety information.
Wonderful. Thank you so much, Elise.
Thank you.
And thank you all for watching and listening today. My guest was Elise Akareri. She is a regulatory compliance and enforcement officer with Health Canada's Consumer Product Safety Program. You can find more details on what we discussed. It's still there on your screen right now. Canada.ca/safe sleep is the website you want to go to. If you want to watch this program again, if you want to share it with someone in your life that you think might be able to take something away from it, you can find that information on our website, which is canadianpreemies.org. You can see it there on your screen now. A replay of this discussion, this presentation will be there, as well as all of our previous Preemie chats. I would like to thank you for joining me and to thank our sponsors that make this possible. Canadian Premature Babies Foundation is a charitable organization. It's thanks to sponsors and donations from people like you who are watching that help keep us going. If you have the means, if you'd like to make a donation, you can do it on our website, canadianpreemies.org. You can also take a minute just to like, to share, to tell someone about what we're doing here. We do present Preemie Chats every Friday afternoon at 1 p.m. Eastern, so I do hope that you will be able to tune in again. And until then, take care.